Hello, the Data Doctor here. Let's talk about the inconsistencies in this week's developments around autism research and data collection efforts. It has been a wild roller coaster of contradictions with the Department of Health and Human Services and the NIH. Here's what happened. First, reports broke that the Trump administration under RFK Jr.'s leadership at HHS was planning deep cuts, $800 million, to autism research funding, gutting key initiatives at the NIH. Then NIH director and RFK Jr. announced a new initiative called Understanding ASD, describing a national platform to siphon health data from healthcare sources to create a national autism registry. He described it as a platform to bring fragmented data together from autism, diagnosis, family histories, and other sensitive data, which would have enormous legal implications impacting ethics, privacy, consent, and surveillance. Almost immediately, alarm bells went off because there was no mention of informed consent, no outlined privacy protections, no clear framework under HIPAA or human subject research laws. Facing backlash, HHS and the NIH walked it back, stating there would be no autism registry. And just days later, surprise announcement, $500 million in new funding for autism research without any clear explanation for the sudden reversal from proposed budget cuts. I don't know. You have to ask yourself, do I trust it? Okay, why should you care? Had the National Autism Registry moved forward, it would have lacked transparency, consent, and basic safeguards. Research of this nature must follow strict legal standards like HIPAA and the Common Rule, which require informed consent and IRB oversight, none of which were clearly in place. Sudden reversal by HHS points to either poor planning or concealed intent. Given RFK Jr.'s history of anti-vaccine and activism, the silence around public health surveillance should concern all of us. RFK Jr., now Secretary of Health and Human Services, is using his powerful new role to advance a long-standing debunked agenda linking vaccines to autism. Without clear consent, oversight, and legal safeguards, this data could be weaponized for political targeting and misinformation, eroding public trust, threatening the privacy and rights of millions of families. Allowing the government to quietly collect and centralize autism diagnoses and other health data without clear consent sets a dangerous precedent. HIPAA only permits health data use for treatment, payment, and healthcare operations, nothing more. If this boundary is crossed today, what's to stop future collection of deeply personal data like mental health records, reproductive history, or genetic traits? It's a slippery slope towards unchecked medical surveillance and a direct threat to your privacy rights. A sudden $500 million commitment to autism research, announced only after public backlash and policy confusion, raises serious concerns about transparency and priorities. Let me sound the alarm. This isn't just about autism, it's about your health freedom, your family's medical privacy, your rights. What can you do right now? Start asking questions. Reach out to your state and federal representatives. Ask directly who is collecting autism-related data, where is it going, who has access, and under what authority. For ease, I have developed a quick reference guide for you to download in the description. Know and use your rights under HIPAA and many state privacy laws. You have the right to control how your health information is used. If your data or your child's data is being collected without consent, file a complaint with the Department of Health and Human Services for Civil Rights and your state attorney general. Be selective. Opt out when needed. Think twice before filling out medical surveys or participating in studies. If the purpose isn't crystal clear and the consent isn't explicit, again, think twice. Raise awareness. Share this YouTube video with everyone you know. Talk to other parents, educators, and advocates. The more people that understand what's at stake, the harder it is for privacy violations to go unnoticed or unchecked. Don't wait, speak up, push back, because your medical information belongs to you, not the government, not a campaign, and not an agenda. Stay informed, stay empowered. Subscribe to me, the Data Doctor, for more insights about your data, because your privacy isn't just a right, it's your power.